moving outer skin of Paro. And few patients developed close attachment and refused to take their meals and go to bed without Paro. And on observations, they have found that there is no reduction in the repetitive behaviors of dementia patients. And then lastly, the Pepper. It is an interactive robot. It interacts with the patient. It is designed to interact, but it needs a staff to stand next to it, to monitor its movements and to pass the instructions to the patients. So it is consuming manpower. Based on this use of robots in elderly care, Japan has conducted a national survey over 9,000 elder care institutions in the year 2019. And they found that only 10% have been introduced robot care. And the result shows that they have been used only for a short period. Coming to beneficence, here we have, coming to the issues in the beneficence, we should always consider how the technology shapes the nurse-patient relationship in respect to the expectations of patient and perceptions of caring. For example, AI may replace the need of nurse in feeding or providing medications to the patient. Simultaneously, it is diminishing the frequency of physical touch and nurturing care. The absence of touch and nurturing care will diminish patient perception of caring relationship. And due to unfamiliarity with the robots, patient may not build trust and establish relationship. And advocacy may not be possible because it lacks the ability to truly understand and empathize with its patient emotions. And coming to the willingness of patient, it is a question mark because robots may not fully replace human nurses. So patients will not be willing to accept robots as a care providers. Justice. We know that all patients are having right to be treated fair and equally by healthcare professionals. Coming to AI, the population data can easily overshadow the minority health needs and perpetuates disparities because it inherits the bias from its training data. If we see a small example of AI bias in socioeconomic status, if the data is feeded like people with low socioeconomic status have higher health risks than the people with high income, it shows a negative result. The AI-based model becomes biased because in the actual scenario, even the people with high income have higher health risks. We do have another example on Alzheimer's diagnosis. When the data is covered from a limited range of patients and applied to the wider range of patients, AI will fail to identify the Alzheimer's patients as per the classification. And even if we train the AI on different treatment options for the patients based on their group, it can exacerbate the racial and socioeconomic disparities, which is contrary to ethical nursing practice. Here, some groups may end up being favored and other peoples will have poorer health outcomes. So it is need to find a right balance between AI advancements in healthcare and ethical consideration of using in AI nursing. And the only solution lies is that AI-driven technology should provide benefit to the patient without compromising the patient rights and well-being. Coming to confidentiality, here we protect the patient data. We will not disclose to others without his consent. But in AI, it raises a number of concerns related to collection and handling of data because it discloses for the purpose of transparency. That means here AI is not able to provide privacy for the patient data, and it is difficult to evaluate the ethical consideration of health records and health information sites. And patients will be having concern about their data privacy, and they do not understand fully how the data will be utilized by the AI applications. Next, accountability. Here, while AI has the potential to act as a nurses, it also raises some looming questions that who is accountable for taking decisions in patient care? Is it technology or human? So the guidelines must be established and accountability must be understood. All healthcare professionals must critically evaluate whatever the AI gives the instructions. And we should ensure that they should they should correlate with the clinical expertise. Otherwise, it may lead to the ethical errors in nursing. We have some supporting articles about using AI in nursing. AI in nursing practice, addressing ethical concern. Can AI replace the unique nursing role? And lastly, human resilience in nursing, why AI can't replace compassion. Now we'll see one by one. The first article was published by Chaikul and his team in the year 2023 on AI in nursing practice, addressing ethical concerns. Here, they have suggested few roles for AI in nursing, like examining and diagnosing the patient's symptoms, and it can help in the drug dispensation. And AI can also give health talks to the patients, either in the OPD base or in the inpatients. It also helps in managing the nursing workflow by assisting in the needs of the patients. And while adopting AI in nursing, they have advised to consider few ethical elements, which we have discussed earlier, like autonomy, privacy and confidentiality, bias and discrimination, data privacy, and accountability. And they do have provided some recommendations to use AI in nursing. They are users and stakeholders should be deliberated how to use AI and the areas to be concerned. And policymakers should address the ethical issues, and they should provide continuing education for the practicing nurses and the integration of AI into nursing education to be provided for the nurse practitioners. Next article was by Mohana Sundari and published in the year of 2023 on Can AI replace the unique nursing role? Yes, AI can aid in the data-driven decision-making and administration of tasks. But nurses excel in critical thinking, adaptability to dynamic situations, patient advocacy, and establishing human connections. In nursing, a delicate balance emerges between AI and human touch. It lacks the emotional intelligence, empathy, and careful understanding, which are core to the nursing care. So we may face challenges with AI like potential errors and bias in algorithms, data privacy concerns, legal and ethical issues, and resistance to change. If once we train the AI on one aspect, it will do the same thing. It won't be able to adapt to the changes. The article summarizes about the role of AI should be to complement, but not to replace the unique skills and empathetic aspects of nursing care. The last article was by Murphy K, published in the year of 2024 on human resilience in nursing, why AI can't replace compassion. If we see the ethical issues he has given, like limitations in the communication. Yes, AI can share information, but it falls short in how nurses communicate. Nurses bring a personalized touch in their conversation with the patient. They build trust and helps in the overall patient well-being. And it can't provide patient advocacy. AI may face challenges in fully understanding the patient background, like their culture and their beliefs, which are essential to provide personalized and effective healthcare. But as a nurses, we daily address the medical concerns on behalf of patients. Day before yesterday, while I'm going to administer medication for the inpatient, on the way I noticed a HEMAT child with a gait impairment. And I suggested that recently he has discharged after taking his chemo. I suggested mother to show to the treating physician. And also at the same time, I said to the concerned resident to examine the child. Because gait impairment and the peripheral neuropathy were the complications of chemotherapy. So on the daily basis, we as a nurses address n number of medical concerns on behalf of the patients, which will be useful for the early identification and prevention of further complications. Next, unable to deliver holistic care. Here, AI can support but cannot replace the collaborating nature of nursing practice. As in nurses, we play an integral role in collaborating both medical and non-medical professionals in providing holistic care to the patients. We do have a child with necrotizing fasciitis who underwent cadaveric graft. So we carry instructions from the medical team, and at the same time, we collaborate with the dietitian and physiotherapist for fast and better recovery. And AI does not possess genuine empathy, but it can be programmed to identify, to respond to the emotions based on the predefined patterns, but it doesn't experience the emotions. Because empathy is a deep understanding of emotions and sharing the feelings. AI lacks the qualities of emotional response. We have recommendations from the professional bodies like integration of AI in nursing must not alter the goals of patient care. Yes, it cannot neglect the nursing aspects of patient care, which is to be provided with compassion, trust, and caring. And in order to be relevant to the changing landscape, AI can be adopted with consideration of ethical elements. While using AI without careful consideration, it may lead to the ethical problems in nursing practice. And nurses should be a part of drafting policies and legislation accountability system for ethical design and use of AI in nursing. And we do have challenges with AI in Indian nursing system, like shortage of qualified health professionals, shortage of infrastructure, poor affordability of healthcare expenses, lack of awareness, lack of access to healthcare services. Here, due to AI, it may lead to uneven healthcare access across the country. Like professional bodies says that ANA, American Nurses Association says that systems and technology that assist in clinical practice are adjunct to, not replacements for the nurses' knowledge and skills. And as per American Medical Association, they say that AI does not replace the nursing care or care provided by other members of interprofessional team. AI can augment, support, and streamline expert clinical practice. At the end of the session, I would like to say that nurses are considered as unsung heroes of society. Their hands-on experience lead to the evolution of few inventions like neonatal phototherapy, invented by Sister Jean Ward to reduce the bilirubin levels in neonates. And the iPads were invented by Billy Bonnet to protect the eyes of neonate from the UV rays, which generates from phototherapy. And the feeding tubes invented by Bessie Blount Griffin. During the World War II, many soldiers were paralyzed. So to meet the nutritional needs, she has invented the feeding tubes. Anita Dorr invented the crash cart. Initially, it was named as a crisis cart. And now this invention, we can know that it can be used as a lifesaver. And ostomy bags were invented by Sister Dora. Even in army, many of our nursing leaders has invented many things. Just one thing I would like to share, which I know since I have been worked under her leadership. Ma'am Brigadier S.V. Saraswati has retired. And during her tenure in the CTC as a voting matron, she has invented drape kits for cardiac surgery and suture kits as per age and surgery, which will ease to the workflow of surgery team. Ultimately, it can show the success rate. So we must salute the nursing seniors. Always they show the pathway for the juniors to render the comfort patient care and also to access skills in the nursing care. And I would like to summarize the topic. Without better understanding of AI implications and unintended consequences, it has the potential to cause tremendous harm. We can see here recently Saudi launched a humanoid robot to greet and guide the passengers. But it touches women inappropriately during the presentation and it leads to the talk of the town. So a cautious and informed approach, ongoing solution, robust training, and ethical considerations are vital to ensure the deployment of AI upholds the standards and values of healthcare. And I conclude the session with a quote, "Do what is right, not what is easy." Thank you.
Thank you, Major Nagalakshmi, for an